effective. We have, of course, uric acid for gout. We have sugar and for diabetes. And a very important one is the hemoglobin H1C. And very many of you are diabetic, and the way the doctor checks you for your diabetes is to do a hemoglobin H1C, which tells him how you have been behaving over the last 2 months. Not the last 2 days or the last week, but the last 2 months. So the goal is to get your hemoglobin H1C at 7 or below. Yes, ma'am? Huh? Yes?
What, you skip, after, when you're talking about the Billy Rubin,
Yes.
I can't remember what the SGOT and SGPT is.
SGOT is serum glutamic oxalic transaminase.
I'm so glad I asked.
And that's why.
What is it, I mean, why do you look for that? What is it?
That SGOT and SGPT are two very important enzymes that are working in the liver. And if you get hepatitis or any involvement of the liver, the SGOT and SGPT can go sky high. You get hepatitis A and it'll go up into the thousands. And it's a very important study. See, if all of these studies are normal, you've got a normal liver, forget that and go on to something else. But we have very good ways of following liver disease by the use of one or more of these studies in the panel. Another common one for liver disease is the prothrombin that we use for control of albumin. The prothrombin has to do with vitamin K, which is a big factor in the liver. That's where you get the substance that helps you to clot your blood. So again, there are many things we can do to check liver function. Thyroid function is, we'll get into the hormones a bit. Thyroid function is controlled by the TSH, which is thyroid stimulating hormone. That's a hormone that comes out of your pituitary gland in your head. And this tells your thyroid, make more thyroid. And then we have T3, and T3 is the active thyroid substance that does the work in controlling your metabolism. And T3 is the medicine that you take when you take thyroxine. Yes, Martha?
Do these two constitute the thyroid panel?
Yes. Yeah. They can throw in a few more, but these are the essential ones. Yeah. Alina?
I have been having aflatoxin.
Alina, you're too old for my I got a special thing for you, Alina, at the end. I've got Mediterranean anemia.
Mediterranean what?
Anemia. The only person in the room who has Mediterranean anemia is Alina. But I got a special thing for her at the end. All right. Prostate, that's a good one. The PSA, the prostate stimulating antigen, PSA. This is an extremely valuable study for men that should be undertaken somewhere between the age of 40 and 60 to establish a baseline. The PSA, generally speaking, should be under 4 units. Now, let's say, for example, you get a PSA of 2 at age 60, and then at age 65, it's 2.2, and at age 70, it's now 3.2, and at age 75, it's 5. Now, that shows you a curve upward from 2 to 5. That would indicate that there is some activity in the prostate, and you have an excellent chance of having a malignancy. And therefore, that kind of curve of trend means you have to have a prostate biopsy. And when they do a prostate biopsy, they don't do 1, they do about 12, and to see if you have a malignancy. The problem with the PSA is that they're now saying, and we've been using PSA for 20 years or more, the problem now is they're saying that men over the age of, let's say, 80, 85, should not have a PSA. Because the PSA, even if it's elevated, even if you have a prostate cancer, is very unlikely to cause your demise. It is most likely some other thing that's going to kill you rather than the prostate malignancy. But a PSA is extremely valuable, especially in young men. Suppose a person 60 goes in and they got a PSA of 14. Well, right away you jump on that and you do the biopsies and see what you can do about taking care of their malignancy. Any questions about prostate? That's a hot topic these days.
Are there lots of different opinions as to whether you should take the PSA over
Yes.
70 or 80?
Yeah, a lot of doctors will now say, well, you shouldn't do that because if you do it, all it's going to do is upset you because you're going to send you for biopsies, which is not a very comfortable thing to have. And then even if they make a diagnosis, they're probably not going to do anything about it anyway.
Yeah.
Although maybe they will, you can tell. There's such a thing as a Gleason score, where the pathologist takes the biopsy specimens and he grades them. And if your score is 1 or 2 or 3, it's no problem. But if your score is 8 or 9 or 10, you better get something done about it. So there are other ways of checking it. It's a big thing because PSAs, let's say we did PSAs on every man over 60 every year. Well, the cost of that is unbelievably high. Anything, yes?
A while back, I heard of a procedure, and I don't remember the technical name, but they referred to it as microwave to do with the prostate.
Yeah, that's a treatment. That's a
Right.
treatment. I don't want to get into treatments today.
Okay.
Just tests. That's a, prostate cancer is a subject to itself. The pancreas, pancreatic cancer is one of the worst kinds of cancers anybody can get because by the time it causes any symptoms, it's so far along you can hardly do anything about it. So it's a very bad thing. But they put the amylase and lipase in there because occasionally people with gallbladders and gallstones plug up the pancreatic duct, get acute pancreatitis. And acute pancreatitis is a very treatable disease, and when you get pancreatitis, the amylase and lipase go through the ceiling. Okay, hormones, estrogen, any hormone that you can think of, we can do a test for. And what good does it do? I think it just causes more mischief than anything else, especially when for men who are, practically every male in this room would be diagnosed as low testosterone. And every female in this room would be low estrogen. But there are uses for these in much younger people. Any mineral you want to talk about, we can check. Lipids. Lipids extremely important in terms of heart disease. And what we're looking for, as we talked about this in the past, we're going to talk about it again. Total cholesterol, we're going to shake you up a little bit. Total cholesterol, in my opinion, should be less than 130. When I practiced medicine, it was 300, then 200, then 160. Now it's 130, normal. Just like blood pressure. Blood pressure used to be
100 plus your age.
160, yeah, 100 plus your age. Pretty high. Now it's 140. They want it at 120.
They're happy when it's 110.
Yeah, and you get down to 105 and they pick you up off the floor. The HDL is the good lipid. It's called high density lipid. It's the good one, the one that protects you from circulatory cardiovascular disease, atherosclerosis, calcium plaques, and so forth. So the LDL is the bad one. And the bad one, it used to be 160, 120, and now it's 100.